Hello, my name is Isaac Bragg, and I'm going to present about hypertension with a focus on the older population. So here are my objectives, and I'm going to read it to y'all. So students will learn the basic pathophysiology of hypertension. Students will learn the new guidelines of blood pressure ranges and know what the acceptable ranges for elderly clients. Students will learn the risk factors of hypertension. Students will learn how hypertension affects older patients' ADLs. Students will learn preventions and interventions to decrease the risk of getting hypertension. Students will learn how dietary approaches to stop hypertension, or DASH for short, can decrease patients' blood pressure. And the students will know non-pharmacological and pharmacological treatment on hypertension. Hypertension is an elevated blood pressure that causes the heart to work harder. It is sometimes called the silent killer because it shows no sign of symptoms, and usually the individual do not know that he or she has hypertension. Hypertension has two classifications, primary and secondary. Primary or essential hypertension is a common type of hypertension, and it has no identifiable causes. However, it has recognizable risk factors. On the other hand, secondary hypertension is when it results from other disorders such as cardiovascular, kidney, and coronary heart disease. As we getting older, our arteries are becoming more stiff, and our arteries will lose a lot of elasticity. These factors have caused an increased blood pressure, which is known as hypertension. It is also important to note that there are calcium and collagen buildup on the arterial wall. Now, keep in mind that these types of factors are normal as we grow older. However, it is still necessary to maintain an acceptable blood pressure ranges to prevent any other cardiac complications. Now, some of you may not know that the American Heart Association has changed the guidelines for blood pressure ranges. So you know that if you learn a med surg or in fundamentals, they tell you that stage one hypertension is um one 140 to 149 over 80, and then stage two hypertension is over 160 over 90. Well, pretty much they have lowered it so that way we can treat the blood pressure much more effective before any other complications get any worse. So pretty much the normal range is still below 120 over 80, and then for the pre-hypertension, it's 120 to 129 over less than 80, and then stage 1 hypertension is now 130 to 139 over um, between 80 to 89, and then stage 2 140 over 90, and then if a patient have hypertensive crisis, it be considered to be 180 over 120. So if we so if you're wondering what's the a okay ranges blood pressure ranges for the elderly, the recommendation blood pressure for an elderly patient who aged between 60 to 80 is below 150 or 90. So if we can get around that, it'd be good because, like I said before, as we get older, our blood pressure will increase, and it's nothing that we can really like help decrease it, but we like help them to get around that ranges. that will prevent them, you know, getting any worse complications. However, if the patient is older than 80 and frail, then it is important for us nurses and the health provider to assess them even further. Alright, so now I'm going to talk about the risk factors of hypertension. So I'm going to start off talking about modifiable hypertension first. So, an obesity is an increased BMI, which is body mass index, that causes heart diseases such as hypertension, coronary heart diseases, heart failure, stroke, and etc. High sodium intake can increase blood pressure because it can cause vasoconstriction. If the patient did not exercise or having a sedentary lifestyle, he or she can gain weight. Consuming high fat intake, such as saturated fat, can form fatty clots in the artery. So, a fatty clot will prevent blood transporting oxygen to the designated tissue, so which it will lead to, um, you know, it will damage the tissue. So just keep that in mind. Smoking cigarettes can cause an increased sympathetic nervous activity. Consequently, it causes an increase of myocardial oxygen demand due to elevated blood pressure, heart rate, and myocardial contractility. High intake of alcohol can increase blood pressure as well, and I will get more in depth later on. Now moving on to non-modifiable risk factors. Increasing age can cause elevation of blood pressure. Males are more prone to hypertension than female. African Americans are more risk than other races, and family history and even genetics can link to hypertension. So there are three problems that how the hypertension can affect the elderly client's activity daily livings. So I'm gonna start off talking about decline how it declined elderly cognitively. So before I do that, I like to talk about the mild cognitive impairment, or MCI for short, first. So it pretty much is when a patient has a memory or and or have a motor performance problems due to how the hypertension can affect their the brain not getting enough oxygen, which of course leads to stroke. So with the brain tissues are dying, it can even increase more risk for MCI or even worse, dementia. So the common risk factors that cause um, cognitive deficit are high fat diet and a lack of exercise. So the article has stated that DAS or Mediterranean style diet have shown to improve the participants' cognition, and it also has decreased risk for MCI or dementia. Additionally, exercising also shown to maintain cognitive function and prevent dementia. Now move on to how hypertension decreased physical activity and increased development of other disabilities. So evidence shown that hypertension can decline an elderly person walking speed. So this may have effects on they shopping or other activities. So they are also in risk of getting sarcopenia and diabetes due to the increase of inflammation and oxidative stress from hypertension. Interventions for this problem is to take antihypertensive medications like ACE inhibitors can slow the process. However, it is more effective if the client exercise too. So, on other words, if you give them ACE inhibitors or any other hypertensive drugs, make sure you encourage them to exercise too, which it will help them uh, increase their physical activity. However, giving them antihypertensive drugs can create a brand new problems on the client. The common side effects from the antihypertensive drugs causes dizziness and syncope due to hypotension and low cerebral perfusion. Therefore, it decreases the risk for client to fall, which it might result in a bone fracture. A bone fracture on the elderly client can create hardships on them, such as difficulty to bathe, dress, shop, and cleaning. So if you really think about it, when I talk about how hypertension can decrease cognitive, you realize that it does not mention about giving them um, antihypertensive drugs. So so pretty much it will so pretty much you have to assess them, which is that problem that they are facing. So fractures can also cause them to stay in long-term care facility even longer. So although antihypertensive medications can cause fall risks, hypertension in general can cause skeletal problems such as osteoporosis. Hypertension can increase urinary calcium excretion and the mobilization of calcium from the bones. Additionally, angiotensin too can increase osteoclast, which leads to more bone breakdown. In order to decrease risk of falls and fractures, the nurse should initiate the drug low and slow as possible and provide them vitamin D supplements to promote calcium absorption. So before we plan to give them any pharmacological medications, it is important to give them a dietary plan, such as the dietary approach to stop hypertension or salt or for salt dash. So in a nutshell, dash is pretty much a diet plan to reduce the client's blood pressure by giving them um, healthy selection of foods such as fruits, vegetables, and low-fat dairy products. So there's another diet plan called Mediterranean diet, and it's similar to that, except it's mostly like consists of like healthy fats such as oil and nuts, and there are a lot of nutrients that can actually decrease blood pressure. Like if the clients increase their proteins intake, it can help them decrease their blood pressure. Eating healthy fat from fish oil, like omega-3, for example, can also decrease blood pressure. And it is important to restrict the sodium intake. So like they need to consume less than 2,300 milligrams of sodium per day. And however, if they are very sensitive to salt, then they should consume 1,500 milligrams of sodium per day. Potassium supplements can also help them decrease their blood pressure. So, according to the article that I found, 4.7 grams a day is good recommendation for them. Magnesium is a good uh, supplement for them too to decrease their blood pressure. Uh, Now, limit alcohol can also help them control their blood pressure. So pretty much drinking in moderation won't really hurt them that much. So it will recommend that the man can drink um, can drink 2 alcohol glass or whatever per day, while the woman need to drink um, one glass of alcohol per day, and fibers can help decrease the cholesterol and decrease risk of heart disease. However, there is so little evidence that fiber really can decrease blood pressure, but it's still um, good to consume fibers anyway. Exercising is a great tool to lose weight, thus decreasing their blood pressure. Working out has many benefits to the client health and decrease other disorders such as coronary heart disease, stroke, type 2 diabetes, colon cancer, breast cancer, depression, and metabolic syndrome. On average, it is good to exercise about 3 days a week and do it for at least 30 minutes. There are many types of exercise that the patients can enjoy to do, such as bicycling, dancing, yard walk, golfing without using carts, light jogging, swimming, and a briskly walk. Cigarettes cause an increased risk for cardiovascular disease like hypertension. This is due to the increased sympathetic activity, which also increases myocardial oxygen demand through increased blood pressure, heart rate, and myocardial contractility. It is crucial for the nurse to assess their smoking history, for example, by asking them questions like how many packs a day they smoke, encourage to them to quit smoking, assess that they're willing to quit smoking, and make sure to arrange a follow-up appointment if the client is willing to quit. Transcendental meditation and biofeedback techniques are effective to decrease their blood pressure. There are many different results about yoga and acupuncture, but the American Heart Association suggests that it is not effective to decrease their blood pressure. Self-measured blood pressure monitoring can help us check our blood pressure by eat right or control our stress. Diuretics, specifically thiazide, is preferred to be used first because it is less expensive and well tolerated for patients. According to the article, it has a significant reduction of stroke, coronary artery disease, and chronic heart failure. Calcium channel blockers can be implemented too if the diuretics are contraindicated or the patient might have angina or heart rhythm or conduction problem. The side effects to watch out for from calcium channel blockers are constipation, bradycardia, and possibly potential heart block. So the clients have constipation, you probably have to provide them with stool softener or fibers. Do not administer if the client have other heart issues like cardiac conduction or left ventricular systolic dysfunction. Its inhibitors drugs can inhibit the conversion of angiotensin 1 to angiotensin 2. Furthermore, it prevents the constriction of the vessels and also prevents the production of aldosterone. Common side effects are dry cough and hypertension. So remember, if you provide the drugs like as inhibitors, the number one side effects to look out for are dry cough. Angiotensin receptor blocker drug causes the angiotensin 2 molecule not not bind on the vascular muscle, which leads to vasodilation. Additionally, it decreases the production of aldosterone, therefore it is decrease of sodium reabsorption and fluid retention. And lastly, beta blockers is really not the preferred drugs to use because diuretics are much better to utilize. But evidence shows that beta blockers are effective towards myocardial infarctions, but not stroke. Thank you for your time. And if you have any questions or need more clarifications, please send me messages in Canvas, and good luck in the rest of the class. Thank you and have a good day.